Hey everyone, Ricky here. Welcome back to another video. Hope you're having a wonderful day as well. Today I wanted to sit down and talk a little bit about my journey into pharmacy, how I landed on it as a career, and what the process looked like going from high school into college and ultimately to pharmacy school. My goal with this video is, to shed a little bit of light on the process and to clear things up for anyone who's interested in going into pharmacy school. So I'm originally from Albany, New York, which is our wonderful state capital. And, growing up, I didn't really have a huge inclination that I wanted to go into pharmacy. In fact, I didn't make that decision until I got into college. I was always interested in science, going through middle school and high school. And it was actually my father, who was a CAT scan technician, who even suggested the idea of going into healthcare to me, at that time. Nevertheless, my first big step was, I think, in my junior or senior year of high school. I specifically took a biochemistry course. For those of you who aren't, so familiar with biochemistry, it's basically the intersection of biology and chemistry. So kind of how living systems work, and then how drugs and certain molecules work, and combining that and how those things interact. It was really nice hands-on lab course, and I really enjoyed the science behind it. And so I ended up committing to the University at Buffalo for my collegiate education. And I actually went in as a biochemistry major. So I wasn't even in pharmacy at the time. Just so happened during my first semester that I met a couple great friends now that were pre-pharmacy. We had similar career and sort of scientific interests. And so they said, hey, why don't you consider, pharmacy as a career? So I sat down and I looked at it. What can pharmacists do, right? Pharmacists can work in the retail setting, so CVS, Rite Aid, Walgreens. They can work in hospitals, which is what I do right now. Pharmacists can work in industry as medical science liaisons. They can also work in certain governmental organizations. They can work at the Food and Drug Administration. So as I looked at that, it seemed like there were a lot of potential, good job opportunities after college. And for that reason, I made the switch during my first semester to pre-pharmacy. So in terms of, how many years of college and all that, it will depend a little bit on what area of the country you are, even what country you live in. I'm based in the United States. And in New York, you could really go about it in two different ways. The way I did it was what we call an accelerated pharmacy program, where I did 2 years of a very condensed and pretty intense undergraduate course load, and then went right into pharmacy school for 4 additional years. So in total, 6 years of pharmacy training. The other way you could go about this is just pursuing a typical bachelor's degree in whatever you're interested in. A lot of my pharmacy school friends would get degrees in chemistry or biology or just like a general scientific degree. And then using that bachelor's, they would apply through the traditional pharmacy school application process. So the benefit of doing the accelerated route, which is what I did, was that as long as you got through the undergraduate studies, you did not have to go through a rigorous application process to actually get into pharmacy school. All I had to do was submit sort of a more abbreviated informal application and then do an on-site interview. But the expectation was that you would get accepted. The con to that strategy is my undergrad was very intense with a lot of scientific courses built in. I was taking, biology, biochemistry courses, general chemistry, organic chemistry, anatomy and physiology courses. I was doing actual lab hands-on courses in chemistry, teaching assistant courses, all in 2 years, so a very condensed time period. I also had to take physics, which was not my favorite course. And I actually had to take that over the summer just so I could get all my credits done on time. That's another con of this process, is sometimes you'll have to take some summer courses to get everything done, by the time those 2 years are up. So the University of Buffalo School of Pharmacy focused very heavily on clinical education. And what that means is they really set us up well to go into pharmacy residency and clinical work in like hospitals after graduation, if that was our desire, but still gave you a very broad-based education to make sure you could be successful in industry or retail, governmental work, or any other area of pharmacy that you went into. So over the 4 years of pharmacy school, the first year was a lot of basic introductory courses, pharmaceutical calculations, pharmacy law, pharmaceutical care courses where you get to practice patient counseling. You get to practice being in a mock pharmacy and filling a prescription, counseling patients and dispensing that prescription, hands-on time with certain over-the-counter products, and doing certain clinical assessments. I remember vividly the diabetic foot exam using a microfilament needle, which was really interesting. So besides those core competencies, we also start something called IPPE rotations, or introductory pharmacy practice experiences. That's where you actually go out into the real world and you shadow pharmacists that are practicing. So you could shadow at a Rite Aid or a Walgreens, which is required. They also require you go to a hospital and you shadow pharmacists there. And the whole goal isn't for you to start doing any pharmacy work. Matter of fact, we're not licensed, but just to get a sense of what those pharmacists do and to sort of reflect on that. After you get through the first year of pharmacy school, and in that summer break going into the second year, that's when you would apply for your pharmacy intern permit, again, at least in New York State. And the pharmacy intern permit really opened up the world because you could then start to actually do things on rotation, and you could even get an internship and make a little money during pharmacy school, which is certainly a good thing. During the second year, it was more of the same from the first: pharmacy law, pharmaceutical care, but now we're getting into pharmacotherapeutics courses. So here, you would have 2 courses each semester, and each course was dedicated to a specific clinical area. So for example, one of the first pharmaceutical care courses, pharmacotherapeutic courses we took, was cardiology. We spent a whole semester learning about everything that you can in cardiology. So you learn about how the heart normally works. You then learn about all the different pathophysiology and all the different disease processes. We even get a little bit of information on how we actually diagnose these disease processes, testing that's done, risk factors for these disease states. And then the bread and butter of pharmacy, you learn about the drugs. You learn about the drug dosing, the name, the mechanism of action, side effects, expected therapeutic effects and how long those take, how to counsel patients on these medications, and really incorporating that all into the overall disease course for a certain disease state. And we do that for every organ system: cardiology, endocrine, respiratory, gastrointestinal, urinary tract, neurology, heme-onc. It was really fully encompassed. As we get into the third and fourth years, you're still taking those core pharmacotherapeutic courses, but you're getting more independence and more experience on your IPPEs, which are your introductory experiences. And as you get into your fourth year, you have your advanced pharmacy practice experiences, or APPEs. The whole final year, you have no coursework. It is solely rotation-based work, where you are out in the field actually practicing pharmacy at as close to an independent level as you can as an intern, with pharmacist oversight. And that year is really great if you're looking to kind of figure out what you want to do after graduation. During that year, for example, I did a cardiology acute care rotation and I fell in love with it. And that's what ultimately led me to pursue pharmacy residency and specialize in cardiology. So that's broadly how pharmacy school works. And probably the biggest question nowadays is it worth it? And, I think the answer has even changed in the, 2-3 years since I've graduated. Unfortunately, the profession has gotten pretty saturated. There's a lot more pharmacy schools opening and a lot more pharmacists who are out there. And because of that, jobs are a lot more competitive and they don't pay as well comparatively for the work that you're doing as these jobs used to. In full transparency, coming out of pharmacy school, if you go into a retail job or perhaps like a staffing job at a hospital, you're looking to make between $100,000 and $120,000 gross per year. Again, depends on what area of the country you're in. And with pharmacy residency experience, especially if you specialize for a second year, that starting rate may be a little higher, $120,000 to $130,000 per year. A lot of times in the past in retail pharmacy, you would get quarterly bonuses and moving bonuses, moving expenses were covered to get you to where you had to go. The reality of the situation is that no longer is as prevalent. Again, because we are sort of saturated as a profession. So what I would say to someone is, if you're looking for a healthcare job that pays well and has a decent work-life balance, pharmacy is unfortunately moving away from that. In retail pharmacy, especially now, pharmacists are expected to do more with a lot less resources. Even in the hospital setting where I am now, not only do I have clinical rounding, but I'm working on 2 to 3 other projects, precepting students and residents, helping with residency program administration, all at the same time. And there's a certain number of people out there, rightly so, who feel that the compensation and certainly the work-life balance isn't where it needs to be. And we're certainly fighting for that as a profession right now. However, what I would say is, if you're looking for a patient-facing healthcare profession where you don't want to necessarily devote all that time toward medical school training, or maybe you don't want to be as hands-on in terms of surgical procedures, but you still want to help people and help patients at the end of the day and amass a really large scientific knowledge base, I do think pharmacy is great for that. You learn so much in school, and you learn so much on the job. And what I have even found being out of pharmacy school now is I'm obviously learning every single day. I'm reading papers, but I'm also taking the time now to actually learn a bit more about diagnostics. I think we get a great baseline education on drugs, but we have the capacity and that baseline knowledge for everything else to start learning the nitty-gritty details about some of the things that doctors and nurse practitioners and other providers deal with on a daily basis. As an example, I'm teaching myself how to read electrocardiograms and read echocardiograms because I see them every day in my practice, and I want to be able to better anticipate what I'm seeing and how those findings can impact drug therapy and patient care down the line. So I hope this was helpful, giving you a sense of how I got into pharmacy, what pharmacy school generally looks like, and what the profession looks like right now. If you have any questions or comments or want to hear more, feel free to leave a comment, subscribe, and follow along. If you're also finding this video, I do have a TikTok account that I'll try and link up in one of the corners here. Feel free to follow me there. I post more brief, kind of impromptu, videos about random cardiology topics there as well. So thanks again for watching, and I'll see you next time.